Conway Medical Center and WPDE News Channel 15 present Your Health, Your Decision.
The rotator cuff is a group of four muscles which function in the shoulder to basically allow one to raise the arm and to rotate in and out, and is very dependent on good function for the shoulder. The muscle is actually attached to the top of the arm bone, and people will commonly get rotator cuff tears really from not doing anything at all. The tendon will actually wear out over time, and people will come into the office a lot and say, well, I didn't fall and I didn't do anything, and I say, well, this is generally a problem that just happens over time, and it's usually patients who are in their 50s and 60s who tend to have problems with the rotator cuff, and they'll tend to have a lot of problems raising their arm up over their head or reaching back in the back seat of the car. They'll tend to have a lot of problems sleeping on their shoulder at night, or they'll get awoken from sleep with pain in the shoulder. So I see a lot of patients who have problems with rotator cuffs in the office. And generally, I'll usually try some conservative treatment first with perhaps a cortisone injection and some physical therapy for rotator cuff strengthening exercises. And once patients have failed that, then they may have to go and have an MRI, which is a special test which will allow us to look at the muscles and tendons in the shoulder itself. That'll give us a good idea if there is a tear or just some inflammation in there. And if it's inflammation, then we'll go back and perhaps do some more physical therapy or another injection of cortisone just to try to resolve the pain. And if they do have a tear, unfortunately the tears don't heal on their own. And so once patients have been diagnosed with a rotator cuff tear, generally the treatment of that is surgical. And nowadays the surgery for rotator cuff tears has gotten a lot better than it was 10 years ago. Most of those tears now are fixed arthroscopically, and what that means is through a couple of small incisions we place a telescope and a camera inside the shoulder itself and use small instruments to repair the tendon back to bone. And that's very successful as far as allowing the rotator cuff to be healed and to allow patients to function properly again. Now, it does take a significant amount of time for a rotator cuff to heal, and so there is a lengthy period of rehabilitation after the surgery. It takes about 3 months to allow that tendon to heal, and patients have to wear a sling for 6 weeks generally, and then go to physical therapy for about 3 months before they are allowed to fully raise their arm and go back to activities such as golf. After the surgery, I will allow patients to get up and move around free as they would like to freely, as long as they wear their sling. They're actually able to bend their elbow and use their hand as long as they're not lifting their arm up over their shoulder height. And they can go back to work if they have a desk job. If they're a manual laborer, they may have to take a more lengthy period of time off. After they come out of their sling, you're still not allowed to lift the arm up past shoulder height until the physical therapists have done so, and it takes usually about 3 months before you can begin to lift the arm up over your head.
For more information, visit us online at conwaymedicalcenter.com.